The evaluation of heart valves with Doppler starts in the peristernal long axis view already. You will use the color Doppler to visualize, in this case, mitral regurgitation. It's probably mild to maximally moderate, but we also do get a glimpse already of the stenosed aortic valve, and there we see that there is turbulent flow across the valve, showing the stenosis into the ascending aorta, but also AR. Continuing in the apical 5 chamber view, we have a good glimpse of, again, the severely calcified bioprosthetic aortic valve, and we do see that there is turbulent flow again. With this turbulent flow across the valve, we do also see a backward flow. So again, we have aortic stenosis most likely and aortic regurgitation. To quantify, we do need several other Doppler measurements and especially continuous wave Doppler. In this measurement, you see a signal, and the signal peaks around 5, a little bit above 5 meters per second, indicating that this truly is severe aortic stenosis in a bioprosthetic aortic valve replaced 3 years ago.